As this is October, this is also Breast Cancer Awareness Month, so we're looking through some of the advancements in cancer care, especially in surgical treatment options for those going through a breast cancer diagnosis. Dr. Vincent Reid, oncology surgeon and medical director at Mercy's Hall-Perrine Cancer Center, is here. Thanks for taking time to join us to talk more about this.
Thank you. Thanks for having me.
For some of the progress we're seeing on breast cancer and survival, what are we seeing from the last couple of years that people should know about?
Well, we're seeing pretty significant improvements in survival. 2019 is predicted there are going to be about 268,000 cases of breast cancer, 42,000 deaths. So if you look at early stage breast cancers, the 5-year survival is around 90%. 10-year survival about 83%. And if the cancer is isolated to the breast, if it's a small cancer isolated to the breast, that's about a 99% 5-year survival. So pretty significant improvements in survival.
You're truly in the middle of this through your work as an oncology surgeon. When people hear breast cancer, I think a lot of times they might immediately think surgery. What percentage actually go through surgery, though?
Well, for early stage breast cancers, actually the vast majority of people go through surgery. For more advanced disease, surgery is not necessarily the first step in treatment, but for early stage cancer, the vast majority of individuals do go through surgical treatment initially.
In the OR, what technology are people seeing more of that might not have been there 10 or 15 years ago?
Well, we have quite a few advancements in technology. If you look at how we localize small tumors now, for example, in the old days we used a lot of needles in the breast to localize those cancers. Today we use more advanced technologies. For example, at Mercy we use something called a Scout guidance system, where you put a small radar reflector in the breast and use that as a guide to guide us to the previously biopsied cancer. We also use something called a margin probe, which helps us detect cancer at the edges of our specimens as we remove those specimens and decrease the likelihood of women having to go back to the operating room for second and probably third operations to have additional cancer removed.
And also hidden scar, we're seeing some of that as well, too.
Yes, we're doing more hidden scar technology, where we're making, with the use of new lighting technology, we're making incisions in the breast in more inconspicuous locations, thereby increasing the cosmetic appearance of women's breasts after surgery.
And where can people go to get more information on breast care and cancer treatment services through Mercy?
Well, you can go to our Hall-Perrine website, and certainly the American Cancer Society website is also available.
And also number 319-365-HOPE. So 319-365-HOPE if you want to call. Dr. Vincent Reid, always good seeing you. Thank you so much for your time.
Thanks for having me.